Good morning, good afternoon, and good evening to everyone who's joining us today, and welcome to this webinar titled Social Sciences and COVID-19 in Southeast Asia, Role and Significance, or Non-Role and Insignificance. My name is Francesco Obino. I'm Head of Programs at the Global Development Network, and I'll be chairing today's webinar. This event is a joint effort between Junction, which is a platform based in Bangkok, Thailand, that facilitates public access to knowledge resources and exchanges among students, practitioners, and Southeast Asia lovers writ large. The Asia Research Center at Universitas Indonesia, which coordinated the scientific side of the project, we'll hear about today. And the project is also co-organized in partnership with the Institute of Population and Social Research, IPSR, at Mahidol University. So first of all, thanks to Canada's International Development Research Center, IDRC, and the small grant that GDN, the Global Development Network, received and that made this project and this event possible. Of course, we're more than happy and eager to share the support with our partners, and we hope to secure even larger support to continue this important work in partnership with IDRC and others. For those who don't know, the Global Development Network, we're an international public organization born 2 decades ago with a very specific mission, which is to promote and support capacity strengthening in social science research, and importantly, in promoting its use across the developing world, for lack of a better term, of course. We design and run research and research capacity strengthening programs in close partnership with research institutions across the so-called Global South, with the aim to boost the contribution of high-quality social science research on development, in development, and most importantly, as development for better lives. Today, we're discussing the results of a project we ran over the summer in 11 countries in the Southeast Asia region. Along with the Asia Research Center, we convened a group of senior social scientists and asked them to look at the contribution of both social science research and social scientists to ongoing COVID-19 responses in their own country. The results will be soon published in a compendium that brings together 11 country notes and a regional overview. Today, we'll hear from and discuss with the lead authors of 3 of these countries which were involved: Indonesia, Singapore, and Thailand. About this event and how we will proceed. Each author will speak to the findings and the notes they worked on over the summer for about 10 minutes each. And then I will invite Professor Vedi from Melbourne University, who accepted to be a discussant for today, and he will respond to the presentations also in 10 minutes. I'd like to invite everyone in the audience to use the chat box or the Q&A section to ask questions, even as the presentations are going on, and I'll make sure to bring, to ask the questions back to the speakers as soon as the presentations and the comments from the discussants are over. A final note: this project is part of a larger global initiative GDN is being pushing forward, called the Doing Research Initiative, through which we're mapping country by country and region by region how social science systems work. That is, how social research is produced, how it is circulated, and how it is used, with the hope to support more evidence-based funding and support to social research. So please follow GDN and Junction and the Asia Research Center and Mahidol University and all our partners to know about ongoing research and future events. Now, I'd like to kick off with Singapore. I'd like to invite Professor Kwok and Woon to start off with his comments on Singapore. Professor Kwok is Professor of Sociology and Associate Vice President at Nanyang Technological University, NTU, in Singapore, and I'll be presenting some of the work he did over the summer with his colleague Liana Daros, who was also a lecturer at Nanyang Technological University in Singapore. Kian, the floor is yours. You have 10 minutes. Thank you.
Thank you, Francesco, and thank you for inviting me. Let me just start with an opening thought But before that, I just come to this line in the New York Times today that the health minister of Germany said that by the end of this winter, just about everyone in Germany will probably be vaccinated, recovered, or dead. So we are talking about a pandemic which has been unfolding over nearly 2 years and is still evolving. So I think our current exercise today and in this project is therefore not just retrospective, but we are also looking at useful and important lessons that we can draw for the months ahead and for addressing issues on the post-COVID transition. Let me just give some background on Singapore. We are an island city nation state. We are predominantly a one-party system with multiple parties which contest in elections, and we do have an opposition. Although on the whole, we have a strong state with some reputation for good governance. So we are not looking at, compared to other Southeast Asian countries, subnational territories and provincial authorities. And in that sense, the whole of government approach taken by the Singapore government is part of its state capacity with many government, with a number of government leaders, especially ministers of important ministries as leaders, and primarily with scientists and medical authorities as advisors. All right? There has been a role for social scientists, but this has not been prominent or central, although I think public health researchers have played a clearer role among social scientists. Now, in terms of the trajectory, I think we have moved from what might be called a war on COVID to living with COVID. And you can see that these are two very different metaphors. Singapore is clearly not taking a zero COVID approach, and it's been moving from prevention of contagion to prevention of death, and towards gradual opening up, including opening up the travel lanes, and there is a strong analysis that there are economic and other costs for not doing so. In terms of death, the latest figure is 667 COVID-related deaths up to, that's the latest figure, and that's about 0.01% in a population of 5.7 million. So I think the concern with the prevention of death in some ways has been quite commendable. Now, let's move into what we were asked to discuss, which were some of the critical blind spots in Singapore's case. In view of the time constraints, I will just highlight two major ones. One, of course, was that within a few months of the pandemic, in spite of early control of the contagion, it quickly turned out that our workers' dormitories, the dormitories housing migrant workers, had very, very high rates of infection, and this caused a lot of concern. Of course, there were concerns about the health and the well-being of the migrant workers. But it does seem that in spite of what seemed like what some people call the Singapore being the gold standard in pandemic management, it does seem that this was a blind spot which quickly had to be addressed. And this led to some months of what was known in Singapore a circuit breaker, which was equivalent or one variation of a lockdown in other countries. The other critical blind spot, I think, came more recently with dealing with the Delta variant. Of course, this was quite dramatic in many countries, and it was dramatic in Singapore to some extent in terms of the concern with the overwhelming of hospitals and the increased deaths, number of deaths. So a good number of the deaths happened in relation to Delta rather than with the earlier phase of the pandemic. And there were issues about the confusion and anxiety among the population, the issues about whether communications could have been better. There were some concerns about the government flip-flopping between different kinds of strategies. Although I think, to be fair, there was a concern with trying to juggle with the different considerations and to calibrate the responses according to each development and each phase of the pandemic. So I think up to today, we are seeing that the hospitals have not been overwhelmed and that avoidable deaths have been prevented. Most deaths are among the older age group and among the unvaccinated, and as well as people with pre-existing conditions. So I come now to the question of the role of social scientists, and in particular in relation to the interplay of state and society. Clearly, in Singapore, as with elsewhere, no state is infallible. No state can do without civil society. This is clearly seen in the worker dormitory situation, because the NGOs that were concerned with workers' welfare, migrant workers' welfare, had already in some ways seen that the housing situation was something that was very precarious in light of the pandemic. Now, I think the role of science and scientists and medical expertise has really come to the fore. In terms of social science intelligence, I think this has not been very clear or very central. And partly, I think it's because the pandemic is seen, as in maybe other places, seen primarily as a health crisis rather than as something that has to be holistically looked at, especially with a very strong interdisciplinary team. All right? Although I think public health as a discipline does involve a marriage between medicine, science, as well as social science, I think perhaps this is not quite enough in terms of, hypothetically at least, how we could have done better. Now, I think this has to be moderated somewhat to say that in the pandemic, with the evolving situation, it's really hard to look at all the unknowns, especially the unknown unknowns, and the extent of the Delta impact, I think, was one of them. Now, just moving very quickly, I would say that hypothetically, the social sciences, if brought into interdisciplinary collaboration with the other forms of expertise, would have been would have played an important role because of the following strengths of social science: systems analysis, looking at social networks and social behavior, looking at the social impact and social costs, not on the part of everybody, because social science looks at specific groups, especially the vulnerable, and especially with pre-existing inequalities. Social science perspectives would also question common sense assumptions, and as well as looking at unintended consequences. It would also look at cultural differences, and especially just to take something which meant a lot to the migrant workers, their social isolation, mental health issues, which were in the end looked at, but even very practical everyday things like the quality of their food, for example. This was something that does need cultural sensitivity. Last but not least, I would look at social science in terms of the need not only for for good communication, but also public education. And as you know, we have a tradition now of public sociology, for example, in which social scientists try to translate their works in relation to the public. Now, I'll move now quickly to say why, in some ways, social scientists have not played such a central role, and not necessarily because they were not included or they were left out of the picture. There were open calls for social scientists to take up grants and to do research and so on. But institutionally, if they were organized in relation to, especially to universities, and if they were working as individuals and groups within institutions, they were then not part of a larger national framework, which had to be coordinated from the top. In fact, in some ways, they were competing with each other to some extent, and their performance indicators were not geared towards real-time addressing of issues as they were unfolding. As you know, if you want to publish, you send an article to a journal. It takes months, if not more than months, for the results to come out. So there are some intrinsic issues. I think the social science intelligence that came out from certain quarters in the civil society, in terms of the NGOs and in terms of the academics who shared their findings and their thinking with the public through, for example, their websites and their webinars and so on. This was a role which was very precious, but perhaps the outreach was limited given the predominant paradigm. Right? So I think there is also issue now, and I'm now moving to my conclusion, about where do we go from here and how these lessons will be analyzed and also remembered in an ongoing pandemic and in the years to come. Because if anything else, the world and individual nation states will never be the same again after this really, really unprecedented scale and scope and speed of this pandemic. And the big question is how the post-COVID world should look like, what it should look like after all the desperation, devastation, and deaths that the coronavirus has wreaked. And even putting it in this way is being not self-reflexive enough in terms of social science, as if assigning the blame to a virus, which is debatably not even a life form. Rather, whether and how we have learned painful lessons and now resolve to prevent and to work towards a better and a stronger future, not only nationally, but also regionally and globally. So that I think is the question. And the manifold agenda that lies before us in relation to inequality, to migrant workers, to frontline workers, to post-COVID work arrangements, to implications for family life, implications for mental health. So I end just with this observation that we hope that the line that has come up, that has crystallized in this pandemic, no one is safe until everyone is safe. We hope that this will really be a new ethos that will take root, right? And in that sense, it's a radical agenda, radical in the sense of addressing root causes, which finally is classic social science, addressing root causes and not just manifestations which are of the time, but somehow not seen to be related to deeper causes. I'll stop here, Francesco. Thank you.
Thank you very much, Kian. I think thanks for this really illuminating kind of overview of your own, reading of the situation in Singapore. I think it's important to, I really kind of agree with that idea that capacity and deploying research capacity is not really about individuals and researchers, but really about where they sit. So the institutionalization of that process of production, diffusion, and use of that knowledge on a very nice list of aspects that you shared with us. So thanks for that. I'd like to move now quickly to Indonesia, in fact, and I'd like to invite Inaya Rakhmani to take the floor. Inaya is the inaugural director of the Asia Research Center at Universitas Indonesia, and the deputy director of the Science and Education Working Group of the Indonesian Young Academy of Sciences. And she has been working on this project with her colleague Panji Anugrah, also at the Asia Research Center and and a lecturer at the Department of Political Science at Universitas Indonesia. Inaya, the floor is yours. You have 10 minutes.
Thank you, Francesco. Thank you to Kian, Woon, hi, Leah, and also Vedi. I would like to latch on to Kian Woon's closing statement and opening statement, which I think is relevant to the Indonesian case as well, and also across the countries that was part of the study. We, in this case, I mean, Panji, the lead author for Indonesia, and myself agree that no one is safe unless everyone is safe. And that was what the pandemic has taught us, that it might be the case that the pandemic is a manifestation of that comes in a health crisis, but the causes were social, meaning that the increasing mobility of people between and within countries, mobility within vital workers across vital workers who are the most vulnerable, as Kian Woon has mentioned in his presentation of Singapore, is in fact at the core of our arguments when studying the Indonesian case. While Kian Woon explained that, began his explanation with Singapore as a single party with a strong state and a semblance of, or with good governance, Indonesia in comparison, after massive nationwide projects of decentralization and democratization after the collapse of the authoritarian rule in 1998, we see competitions and power struggles from local, provincial, subnational, national levels. The pandemic has opened how power inequalities within the political arena among an intra-elite competition or power struggles, as well as social inequalities in the everyday lives of those who are most vulnerable, precarious, and those who are also caregivers. In the response, in the state response toward the pandemic, at the early stages, there was a large downplaying of the actual cases by flagging around slogans to not panic, to focus on continuing on life, etc., that was socialized across official platforms. The executives of the country also use informal channels in the form of influencers and buzzers through social media to mobilize sentiments and manage the mentality of people in various areas across the region in response to or when they perceive the pandemic. At the same time, the number of social scientists involved in the state's responses was minuscule in comparison to those from health sciences, while at the same time, epidemiologists whose findings, while they are internationally acknowledged by the WHO and their counterparts, scientific counterparts in countries managing the pandemic better, were not involved in policymaking, as their findings differed from those that the state is more comfortable with. The main driver for social sciences in the cases that they were involved were largely technocratic, were focused on responding to real-time conditions in ways that manage short-term repercussions of the pandemic, which at the same time are largely marginalized issues of social inequalities, in which those who were already previously marginalized even before the pandemic are even more so. Funding were sourced for social sciences mainly through the state, through direct operational funding from the state budget, It has also been dispersed through institutional channels, such as the case with Singapore, but these are within university structures with very long bureaucratic and auditory-based mechanisms in which findings are shelved in scientific journals. At the same time, though, engagement with localities were only effective in enclaves. Here, the case of Sonjo in Yogyakarta was interesting for us. It's a city, a special province with a unique history in which economists, academics from social sciences, and also anthropology, psychology work together through WhatsApp groups, through messenger groups to mobilize basic services, opportunities for employment in ways that were not apparent in other regions. Another interesting case for us was the fact that many official numbers in the provincial level differs from that of the state level, in which civil society proponents provided real-time and more reliable numbers in comparison to the state from the eyes of progressive media platforms, both within Indonesia, in the region, and also regionally and internationally. These civil society organizations are loose networks and are digitally based. They are also hosting many diaspora, Indonesian diaspora, who were able to gain employment in other countries, such as Singapore, the US, the UK, and Western Europe, who use their expertise, professional expertise in medical sciences, epidemiology, and also social sciences, especially in disaster management, to inform journalists and CSOs in Indonesia. They have more resources, both immaterial and material, to contribute to more community-led movements from Indonesia, but from other countries. Emerging research agendas in social sciences from the state focuses on economic recovery and potentials for capacity building for Indonesian researchers that are actually driven from technocratic policy in the hopes that Indonesian academics, scientists are more able to face future crises. Here, I think the point that Kian made in the beginning was really important, because the pandemic is not the only crisis that we will face. With the COP and many discussions about the Green Deal and ecological issues, the pandemic is in fact an exercise for us social scientists to understand deep-rooted social and wealth inequalities that have made some people more vulnerable than others. And this is in fact externalized as well into the kinds of methods, paradigms, methods of data collection that we use and that are institutionalized and privileged, not only within our national institutions, but also more globally. I here also latch on to public sociology that Kian Woon has mentioned, in which I cite Burway, where all social scientists now live in a time where we too are complicit in reproducing the kind of social inequalities inevitably, because we work from institutions, we have relatively secure employment compared to our research participants that we are hoping to provide more space to be mobile in. In that, social sciences and social scientists have a common task, not only from Indonesia, but also across the region in the global south, to think about ways in which we can use our institutional and academic resources to widen the space for those most vulnerable, and to reflect on not only in retrospect, but also for the future crises that we will be facing together, in which it is no longer impossible to talk about only individuals and communities. We need to talk about all members of society that need to receive basic health social services indiscriminately, as the pandemic state has taught us. I agree as well with Kian Woon that addressing root causes is primary, and it is the task of social scientists to identify those root causes, and also not only to communicate it to the public, but also our counterparts from other sciences in which disciplines are heavily specialized, and data collection is operated within the silos of laboratories. It is also the task of social sciences to not only unpack these deep-rooted causes, but also understand our own social position within larger wealth and social inequalities, so that basic social sciences are more responsive not only to short-term problems, but also long-term problems after our life. Thank you, Francesco. Back to you.
Thank you, Naya, also for raising that hugely important point about not only about responsibility, yeah, of social scientists in contexts like this, and the whole discussion about researchers are public intellectuals working not in isolation, but as part of a system, yeah, at the national level, connected to civil society, to government, and to other actors. Let's move on to Thailand. And I hope we can pick up on many of this really interesting points both Woon and you have made in the discussion. Let's move now forward to Thailand, and I'd like to invite Rosalia Sciortino Somariano, who's actually hosting us today, thanks to Junction, who's managing the logistics of the comms for this event, to speak about the note she wrote with her co-author Vinisa Katiyari. Rosalia is a cultural anthropologist and development sociologist by training, and she's currently associate professor at the Institute for Population and Social Research at Mahidol University, visiting professor at Chulalongkorn University in Thailand, and of course director of Junction. And Vinisa, co-author, she's a graduate student at the Master of Arts in International Development Studies at Chulalongkorn University in Thailand. Leah, 10 minutes. Thank you very much.
Thank you, Francesco, and thank you to all the colleagues in this very interesting regional research effort, particularly Inaya as our team leader, so to say. I am very glad to present about Thailand, where I currently live and work, and I need to stress Sharmil has been crucial because, of course, she is a native in a sense of speaking Thai and doing most of the interview. I will do it in a traditional way using
Did we lose Leah?
Maybe we lose her. Let's see. Yeah, I don't see her in the room.
Yeah, I think she must have dropped
Yeah.
off. Let's give her a second to reconnect.
Francesco?
Yes.
Hi, sorry, I just like to, when I said the percentage of the population and deaths, what I meant was 0.0001.
Yeah, I thought it was high. Yes.
Yeah, right. So please, I apologize for I was a bit too quick with my lack of zeros. Yeah, yeah. So please make that correction. Yeah.
Thanks for the clarification.
Sorry for leaving the meeting.
You're back.
I wanted to say I'm doing traditionally, meaning I will using PowerPoint, but instead of sharing, I basically
hang up.
Well, this shows my technological skill are not as high as I hope the scientific skill. Okay, so I will try to share again the PowerPoint presentation. Okay, I hope you can see it.
Yes, we can see it.
So I will start now. I will skip this part, which basically is about the methodology. You have heard already from Francesco that we have conducted this regional effort, basically a rapid appraisal, 4 months research based mostly on literature and interview with key stakeholders, mostly online. The background for the pandemic in Thailand in 2020, everyone was quite satisfied with what was going on. There was the perceived impression that Thailand was doing very well, that public health had been effective in controlling the pandemic, and that basically Thailand was in a very good position, although there were concerns about the numbers that were being given, and also the fact that there was very limited testing and tracing of people infected through various methodology, which I will not elaborate here. There was also an overrated focus on foreign. Some felt that there was quite some xenophobia going around against Western foreign, but as well as against migrants. And also disproportionate measures were taken in terms of lockdown, disproportionate in terms of the numbers of the pandemic. So while the pandemics was still very much limited, the economic impact, the closure, as well as the security measure, such as limiting meeting of people to more than 5, etc., often had more a political connotation rather than based on the course of the pandemic. There was 2020, 2021, everything changed. Suddenly, Thailand found himself really in the middle of the wave, partly because of the Delta pandemic, but also there has been a lot of criticism in the way the government has handled the pandemic. In this second year was much more centralized in approach. There were delayed in timing, in the selection of the measures taken, as well insufficient stimulus and social protection measure, which didn't allow people to stay at home as was wished for because they were in need of work or going out. So there were a lot of complaints, and the most recent was about vaccine procurement and distribution. There was also a lack of transparency and censorship of information. At some point, the government basically forbid the media to report on the visual of the pandemic, people lining up on the street, or even sick that were waiting to be tested. Suddenly, the media were no longer allowed to report on this kind of situation, as the cartoon show. Today, we are in a better position. The pandemic is under control. We are catching up with the vaccine, and the border finally open. I must say there has been a lot of discussion about tourism, Thailand being highly dependent on tourism. And again, it seems that is the only solution for the future. I will go back to this point later on. There remain insufficient attention to comprehensive prevention, such as discussion, for instance, of better air in malls and other closed space, how to ensure open space, how to treat the pandemic not only with vaccine, because we know that is not enough. Still, not too much discussion is going on about this, but also still a lack of attention for marginalized group, particularly migrants, but also LGBT and even women, in spite of the talk that there is a lot of need to have a gender attention for issue of violence in the family, as well as the extra burden for women. There is still not much attention to that. Now, why? And we find in this position, of course, one part of the reason is biomedical or related to the spreading of the virus, the type of virus, etc. But also policy, of course, is one of the factors that contribute to that. So let's take a look at the policy, and we can see it's been very top-down, very much centered to security concern, not only in terms of the pandemic, but also because of the political situation in Thailand. The structure was staffed by bureaucrats and a lot of military presence, and it has been governed not through the pandemic rules that already existed, but rather through emergency decrees that were issued and extended for basically 2 years. Over time, there is increasing control from the Prime Minister over the Center for COVID Situation and Administration, and less autonomy for the provinces. The approach has been an approach to crisis, a security crisis with very few scientific personnel involved. So generally, it's not been evidence-based policy. I mean, science has been used more in terms of number to justify the political position that have been taken. But social scientists were even less present. We found them, some social scientists in a subcommittee, at the subcommittee level and advisory level, and mostly they are economists and public policy specialists, no sociologists, anthropologists, let alone humanities. So we can say that in the formal approach to the pandemic, social scientists and social science have had a marginal role. They had a marginal role in the formulation and the formal policy making process. When they were involved, the task was very limited, mostly writing official report and management of large database. So the analytical capacity was not properly used. Now, this is something which is very different from the way Thailand addressed the HIV/AIDS pandemic in the 90s and thereafter. So different ways are possible, but this time was not used. Social scientists were not really used for containing the COVID-19. And I want to stress here that social science are important, not only for taking care of the social impact of the pandemic, like better social protection for marginalized group, as it has been stressed by the two speakers before, but to contain the pandemic itself, we need social scientists, because after all, we are talking about behavioral change. And behavioral change is, of course, the bread and butter, so to say, of social scientists. So it's quite interesting to reflect on the reason why they have not been involved in terms of communication to the public, or also to find way to understand the context of why people don't comply with certain containment measure or comply with that. That is all information that would have helped, that can still help with the containment of COVID-19. But if we look at the situation, we need also to understand that the overall policymaker attitudes toward social science, even before COVID, was one of secondary interest, since in the new paradigm of science, social science are seen as unproductive. They are not valuable in terms of innovation. There is no money to make with social science. This is the kind of attitude. So there is much more investment to medical technical innovation, which can then produce economic value. So there is little appreciation for other value that social science clearly produce. The other point is that social scientists have been viewed as critic and as in supportive of state policy. So this is already before the COVID pandemic. If we see all this has resulted in a gap, that we have three main areas of policy focuses: security, as well as macroeconomic, and to a lesser extent, a degree, social protection. But the main consideration have been political and economic in nature, and often bureaucratically driven, with a focus, like Inaya already also stressed for Indonesia, that quantitative data were considered much more important than experiential or qualitative data. More emphasis on short-term measure rather than long-term impacts, and no attention for recovery beyond tourism. Most seriously, a severe lack of integration of available social knowledge. So the social knowledge was there, but outside of the formal structure. This was knowledge on social and health behavior, information on people mobility, how they move around, information on spaces, crowded spaces, not crowded spaces, etc., urban city planning, social network, how people meet, network, what are the network, all information that is crucial to stopping an infectious disease. They could have helped to predict new clusters. They could have helped to design customized policy. For instance, when recommending use of water would not make sense because there is scarcity of water, or when social distancing doesn't make sense because we are talking about very crowded slums. So they could have helped to make customized policy, improve access to testing, screening, treatment, or even access to vaccine, how to talk to people. For instance, there has been a lot of discussion about mistrust of Chinese vaccine. True or not true, for sure, social scientists could have played a role to understand why this mistrust and how to address. And what has been mentioned before, identify vulnerability and social protection measure more satisfactory. As mentioned before, in the case of Indonesia, another case, most of the funding has been through the government. And again, before COVID already, as I mentioned before, the intention is to put funding into science that have economic value on the short term of that. I think all over the world, we see this phenomena that social science are reduced, are cut. Australia is cutting a lot of social science departments, for instance, and also investment in research is mostly in the art science. So this was already happening before, but we see very clear the bias is not even public health, it's really medicine and medical technology which get the majority of the funding, then some public health, some microeconomic, and at the end we see social scientists. This we have seen in the funding of the Ministry of Higher Education as well as Thailand research funds. If you examine the research that is been funding, and for 2022, we see the same bias. Only one area of research deals somewhat with economy and other social aspects. It is the international donors that have supported more varied research, particularly based on marginalized groups. Unfortunately, not so much in medical anthropology and social and medical sociology, which, as I say, I see as crucial. So,
could you wrap up?
Yes, I am concluding here. I think it's important to stress that even if this was the situation, social scientists have not been idle. They have done quite a lot of things. Some of them have still continued with their more technocratic research and feed into policy making, not through the official channel, but more through informal channel, like knowing each other and then communicating with policymakers and try to influence the policy agenda. A smaller stream has focused on raising awareness of the social and human rights dimension of the pandemic. They have proposed many alternative social science discourse on social health behavior, pandemic space, like the space of the border, the closure of the border, what is the meaning of that, the field hospital space, how was organized, for instance, inequity in society, xenophobia, gender, although still not sufficiently experiential aspect, few role on religion and arts. We also see the social scientists have made other valuable contribution, like involvement with community organization, NGOs, and other groups, and they have been key to promote debate in four main areas: securitization of the COVID-19 response, lack of an holistic approach, insufficient social protection response, and vaccination. So in conclusion, despite the lack of official role, social science has been able to fulfill multiple functions. The overall technocratic COVID-19 social research conducted outside of official channels does have value if recognized. Social science data support NGOs and community programs. I can elaborate later in which way. Critical research highlights most important overlooked human and social side of the epidemic and proposed new way of discussing some of the policy that have been taken. Alternative of aspects of the crisis in this way have been brought to public consciousness, and in this way they have created new venues for a more comprehensive, humanistic, right-based and equitable approach, which are still not being done, but hopefully will be part of a better future. Thank you.
Thank you very much, Leah, and thanks already for answering one of the questions which came in the chat about how social sciences actually carved a space for themselves despite being largely outside of the institutional response. I'd like now to turn to our discussant, Professor Vedi Aziz, who's a professor of Asian Studies and director of the Asia Institute at the University of Melbourne, where he's also Assistant Deputy Vice Chancellor for International Affairs. Professor Aziz conducts research on political sociology and political economy of Indonesia, Southeast Asia, and the Middle East. Professor Aziz, you have 10 minutes. Thank you very much for agreeing to be a discussant on this panel.
Yeah, thank you. First of all, apologies for arriving a bit late. Is Kian Woon here? Where's Kian Woon? He's disappeared. I was just following Kian Woon's advice to me when I first arrived in Singapore 20 years ago. He said I should always be fashionably late to annoy everybody. So I blame Kian Woon for my lateness. Good to see Rosalia as well, who I haven't seen in a very long time, and also some faces with whom which I've seen more recently. So yeah, this has been a very interesting exposition of three very, in many ways, diverse cases. All facing the same problem, and that is the emergence of COVID and the COVID crisis, and dealing specifically with the role of social science and social scientists in the handling of the COVID crisis. Now, I'd just like to maybe zero in on a few things. It seems to me that in terms of the role of social science and social scientists, there are a couple of things that can be compared. One is in terms of the context in which the social scientists have been involved or not been involved in the handling of COVID. One is, I suppose, the overall performance of a country like Indonesia, Singapore, Thailand in terms of the handling of COVID. And we see that in these three cases, the performance has been different from the idea that at least initially, Singapore was extremely successful because of its the high capacity state, because of the discipline of its citizenry, etc., etc. But as Kian Woon has also explained, not everybody in Singapore society obtain the benefits of that success in the same way. Migrant workers, for example, who have always been marginalized within Singapore society, experience the brunt of the negative effects of the areas in which the state was not able or willing to control the spread of COVID. In Indonesia, we see that for a long time, especially in the middle of this year, Indonesia was seen as a bit of a basket case following the experience of India, which also had a very serious upturn of COVID cases and deaths earlier in the year. But in the middle of the year in Indonesia, it seemed like nothing was going right, and of course, a lot of that was attributed to the lack of state capacity, to affect and shape the behavior of people, to enforce rules and regulations, and also the inability of the state to develop trust amongst the citizenry. I think compared to, there's Catherine Wong. That's a student of mine. Hello there, Catherine. Are you in Luxembourg? No, you're gone? Okay, all right. Anyway, so in Indonesia, unlike in Singapore, the depiction, at least at a superficial level, is that because of the corruption and the lack of rule of law, in spite of it being a democracy, then the citizens didn't trust the government's rules and regulations, and therefore the government had a very hard time in terms of shaping people's behavior. Thailand, I suppose, in terms of performance, is somewhere in between there. I mean, it's had its ups and downs, as Rosalia has explained. It's not been depicted as successful, in the sense of Singapore, but it's never been the basket case that Indonesia was in the middle of this year. But here you have a situation in which there is a high degree of, I think, growing distrust of the government and of state institutions in general because of the recent demise of democracy. Well, I mean, the slow demise of democracy, we might say, and the military coup of a couple of years ago, which seemed to bring Thailand back politically to where it was several decades ago, and where it is no longer seen to be a beacon of democracy, albeit a flawed beacon of democracy in the region. So I mean, so the context in which social science and social scientists operate in these countries have been different, right? In relation to the performance, in relation, I think, as well to state capacity and state relations with the population at large, civil society, we might say. Now, in those contexts, we see that the role of social science and social scientists have been different as well. In Singapore, Kian Woon has showed that there were all these schemes and research grants and so on that social scientists could apply for, all dealing with the handling of COVID. And yet Kian Woon's conclusion towards the end of the paper really is that social scientists have not been as influential as maybe medical scientists or people in the STEM disciplines in terms of shaping state policy and in terms of shaping the response to COVID within Singapore. So there's a degree of social scientists being asked to be involved, yet being ineffective comparatively in terms of their ability to influence things. In Indonesia, we see that remember, this is a democracy, and often you would say that Indonesia is democracy, and Singapore has got this deserved reputation, if not for being authoritarian, then certainly for a kind of propensity towards technocratic, exclusionary modes of governance. But in Indonesia, you see that social scientists actually have been basically left out in the cold. Well, actually, Indonesia is never cold, so left out in the heat in terms of the shaping of policy and in shaping of responses to the COVID epidemic. What Inaya has shown, though, is that social scientists, through their sort of alliances with local levels of government and with local community groups, with local NGOs, have exerted some degree of influence in shaping responses at the local level, in spite of the central state being largely dismissive of the role of social scientists. In Thailand, Rosalia explains to us that social scientists are regarded, especially in the current context, as a source of criticism of the present regime, and therefore have not been invited into the fold. That social scientists have tried in their own way to sort of cast a spotlight on issues of human rights and well, the social dimensions of the problems of COVID, in spite of the fact that in general they have been left out from the response, at least the official response to COVID. So we get, in Singapore, a kind of involvement with very limited effectiveness for social scientists. In Indonesia, we have a mode where central government dismisses social scientists, but social scientists sort of work with communities and at the local level. And in Thailand, where the state, because of the political situation there, looks at social scientists as a threat, and therefore social scientists have had to be very, very innovative in the way that they've tried to be involved in the debates. So, so different situations there. Now, to sort of zero in on a few things that I think were either explicitly or implicitly sort of mentioned by all three speakers. COVID is a health problem. First and foremost, it manifests itself as a health problem, but it does have a lot of socio-economic dimensions. And because of that, it should be obvious to everybody, even though it may not be obvious to all governments, including the government of Australia, where I live, where in spite of COVID and all that, funding for the social sciences and humanities are being cut. Where anthropology and sociology and so on departments are being closed at various universities. We see that in general, there is a tendency, whatever the regime and whatever the specific degree of exclusion of social scientists, in general, they have been excluded. And that goes for the West as well, right? I mean, even though, in the West, you could have social scientists and so on engage in public debates and write in newspaper articles and so on. In general, it's actually been medical scientists and people in the STEM area that have been more deeply involved in the responses to COVID. In which case, the social, economic, and cultural dimensions of the epidemic really, as a matter of policy, have been relegated to the background by all governments, almost all governments in the world, just with varying degrees of extremes, and maybe with different kinds of patterns of exclusion. But really, I think there is a particular reason for that, and it's not a coincidence that governments have been like this, because as was also explicit in the presentations, in actuality, what the COVID epidemic has shown worldwide, right? Worldwide, and in terms of specific countries, is the social, political, and class inequalities that are entrenched just about everywhere. That's what COVID has shown. And also, the other thing that I don't think anybody's really mentioned, the gendered dimensions of the COVID crisis, where it's not, there's the poor, obviously, those who are like the migrant workers in Singapore, the precarious workers of Indonesia and Thailand, who would be suffering from the limitations of government responses to the COVID epidemic. But we also know that women, for example, have been hit hardest because they've had to leave. Even professional women have had to leave the workforce and have found it difficult to get in the workforce again, for example. So what COVID has done is actually to expose injustices in societies, right? And governments don't like that, right? So and it is actually the role of social scientists, right, to expose these injustices. So what COVID actually does is that on the one hand, it pushes governments to further marginalize social science and social scientists, right? Especially in countries where that tendency has always been present anyway. But on the other hand, it opens up a whole avenue, a whole space for social scientists to actually engage in that didn't exist before. And this is probably something that social scientists and social science, need to actually take better advantage of, because once the health issues and so on are more or less, we hope anyway, dealt with vaccines and so on, its social, political, cultural dimensions, they will linger on. Those effects will continue to linger on and actually, will have an effect on the trajectories of many of these societies, as people who are left out or dispossessed or made poor because of the pandemic, find it hard to get into to the mainstream again. the other thing that I think is interesting, if I may just have one more minute, Francesco, is this. Look, there's always been the depiction of a fight between science, right, on the one hand, and sort of populist anti-science on the other hand, right? The and this has to do with the issue of vaccination, right? But what's actually happened is that the emphasis on the science, while is laudable, has actually strengthened technocracy. And that technocracy is by definition exclusionary in nature, and is only embracing of social science that would cooperate with power rather than question power, right? On the other hand, social science can't also ally itself with populist anti-scientism, right? So this is an area, again, that social science has to navigate through, you know. And in doing so, social scientists have to think, where are their allies? Are they in the state? Which part of the state? Are they in civil society? Which part of civil society? And I think in this way, I think social scientists can make use of that space, you know, to bring up new scrutiny over issues of social injustice and the like, and also play a role in actually shaping or affecting the debate between science, so-called science and populism, but in a way that doesn't actually then, you know, further entrench exclusionary forms of technocratic knowledge. I think that's it. Thanks very much.
Thank you very much, Vedi, for this very interesting set of comments. I mean, reminding everyone that this is a global trend, that what we're looking at here is not just a regional trend, but it connects to experiences in the so-called global north, etc. I think it's absolutely invaluable. And also kind of the realism in your comments about, you know, is this a threat or an opportunity? I mean, realistically, a technocratic, you know, bureaucratic approach to managing a state has only gained from this crisis. So, you know, it's not likely things will get easier for our social scientists going forward. At the same time, obviously, you know, this has exposed injustices and inequalities so much that, and also the limitations of technical approaches to dealing with pandemic, that it should be an opportunity. So, I mean, I really salute your call to strategize, you know, so a call to strategize about the role of the place of social science research in society and what might improve the situation for social scientists. We have a number of questions and only about 15 minutes left. So I'll try to address them all. I think some of the questions about the actual ways, the coping strategies that researchers use in different countries has partly been addressed, and there'll be much more on that in the compendium that will also be published. There's an interesting question from Seema about the publishing industry, yeah, the academic publishing, and whether and the impact basically of what happened in the last 2 years on the publishing industry. You know, is this an incentive for the publishing industry that take, as we've said, so long to bring knowledge out, to rethink itself and find new ways and platforms and channels to bring that knowledge that we claim is so important out in the public sphere? I think that's a very important question. There's a specific question on Singapore about limitations still applied to migrant workers that maybe Ken Woon wants to address. There's also larger questions about the role of the context, political context in which this is happening, and what we can possibly expect in the current moment in contemporary history with the current crisis of democracy as it say, and again linking back to the invite of Vedi to strategize. A question about whether this is an opportunity to raise the volume of this debate or not, from Eggert. Now, who would like to take, I'd like to, there's more questions coming in, but who would like to take some of these questions from our speakers?
Hi,
Woon, you want
Francesco.
to- Yeah. Yes, please.
So in the interest of time, let me give a short response to Latapo, who thank you so much. You've raised a very important question. In the very first place, when infection figures are reported in Singapore, there is a distinction made between community, dormitories, and imported cases. So if you put aside the imported cases, the migrant workers are not seen as part of community as such. You see, so this says something about the imagination of the national population and how it is divided in this case, because there are, of course, foreign employees, foreigners in Singapore who are not in that category of migrant workers living in dormitories. So the control of movements and other kinds of restrictions, I think has been a very big part of that kind of crisis management, which is really giving a lot of emphasis of falling on the side of safety and prevention. And I think there is some room for discretion in how this calibration can be done, especially if one recognizes that recreational needs are part of human needs, and that sociologically, they are of the greatest importance, especially for workers who are living under certain kinds of conditions. So I appreciate the question, and I think that there could be much more done in this area to look closely. And this again is where social scientists can undertake a very detailed study on to make recommendations beyond what has been the case now. I'll just say quickly that it is reported officially that in the last so many weeks, the number of positive cases in the dormitories is per week is about 143. Average daily number testing positive in the PCR test. So you see, there's a lot of room for calibration and for discretion and so on, all of which is really needs attention to the details and an understanding of social processes, including what workers do when they have recreation, where do they go, and how dangerous it is, etc., etc. So this itself is an example of what, is not a very big question, and it's some nitty-gritty question which social scientists can address.
Thank you, Kian Woon. Can I ask you? I think the question we have aligned well with some of our speakers' kind of interests, but also there's one which actually I'd like everyone to address before we close. So I'm just going to ask some of you to answer a specific question and then also this general question. So I'll start with you, Kian Woon. There's a question about what could be a strategic move, basically. I'm rephrasing. What could be a strategic move to raise the volume on the issue of the role, contribution that social sciences can make to public debate and policy, of course. I mean, should we just hope that somebody in the government just changes their mind or is illuminated and decides to bring people in, or is that something that something else that can happen in the meanwhile to help bring closer this knowledge to the sides of policy? So I'd like everyone to start with Kian Woon to also address this question while you take the floor.
So I've spoken enough, so I'll give a quick answer. I think among the many answers, social scientists themselves must come together and also realize that in the face of a pandemic, to use Inaya's words, there are real-time issues for us to respond to, which are not academic in that narrow sense of being academic. There will be time to slice and dice and analyze in every detail, but as the situation unfolds, the impact on real life human beings in real time. Now, if social scientists are not at the center or brought into some kind of interdisciplinary dialogue with everybody else in the national management, I think, well, we ourselves have to do something. The problem is that many of us are all tied up within institutions, doing institutional things, and it does need some kind of sacrifice and some kind of leadership to come together across universities and agencies to work almost like a kind of a parallel group to keep on reflecting and suggesting. I think some of these things have been done, but probably not enough to be prominent. Thank you.
Thanks. That's very clear. So the call for social scientists not to wait for somebody to design a public role for them, but like for social scientists to really, think of their own public role and how to get out of our institution as well. Now, I wanted to turn to Inaya, and I wonder whether you want to address the question about publishing, in fact, from your perspective, and then address this question about what does a strategic move look like for you going forward?
Yeah, I'd like to continue on the points made by Kian, Woon, also Vedi and Leah. I think an underlying theme or underlying cause here is the underlying thing to think of is the task for social scientists to question power structures and how it reproduces social and wealth inequalities, which has been made worse and been exposed by the pandemic. It was also made known by Professor Hadiz in regards to pockets in which the state are either unwilling or uninterested or unable to go into. These feature prominently actually in all three of our papers and presentations. That means that there are areas in which the state is not present. And in the case of Indonesia, there are some regions and localities in which academics work closely with communities. So it becomes a praxis instead of research that ends in publications and webinars. They're actually an interlink between the reflexivity and also the practices of the academics in their everyday settings. So if we return to the idea of power structures, alliances between academics in within a country, between regions, between countries, within regions, across regions, lies where power structures are relatively not present or have a stronghold. So if alliances should be built, I think it should be built to create a larger critical mass. So it doesn't create, or as much as we can, prevent the reproducing of new kinds of social inequalities between social scientists. So the task is to redistribute power, access, and resources. And of course, this is not a small task. It's one to think of long-term. So I hope that answers the question. And also about publishing, using the same logic, it means that open access, opening and using tactics to actually make our work available through social media platforms, because peer-to-peer sharing is fair use, is a form of social activism for social scientists that needs to go beyond their institutional career-based promotions and thinking about only publications for, publication's sake. It's publication for the public. Thank you.
The publisher might still keep their job, but we need to take advantage of other spaces outside of publishing to have this discussion, to bring out the knowledge that comes from research out in the open. Leah, do you want to take the question that interests you and answer the overall question about what could be a strategic move going forward?
Well, I think here I resonate like what has been said before and what Vedi has stressed and Inaya. I mean, it is an issue of power. It is an issue of power among disciplines. This came out also of the Thai forum, of the forum that we have done before. It came out very strongly. We are talking about power relation across various types of discipline. If we see the medicine is always always highest, public health is lower, etc., etc. And then there are all kinds of public perception and policy perception about the value of each discipline. Even public health, I would say, has been discriminated in this COVID-19 pandemic. Maybe because it's somewhat more social and somewhat more about behavior. So we have a disciplinary power structure, we have political power structure. It's been said very clear, the political context influence the way social scientists operate, influence funding stream. We have, of course, politics of donors, the way they give, to what they give, how the funding is allocated. We have gender power structure. I actually had mentioned gender, and I think it's important, right? We are still saying it's important to focus on women, but then we still don't have segregated data. I mean, this is ages that we are asking for those kind of data. It should be possible to have those data about COVID divided by age, by sex, etc., but we still don't have, and this prevents a lot of analysis and a lot of important understanding. So we are dealing with power at different levels. So basically, it is a political response. We need to organize, we need to advocate, we need to look for a sympathetic source of funding. We need to act as political actors within a certain context. Doesn't mean all social scientists are willing to challenge the status quo. No, we have other type of scientists that maybe are social scientists that, as we say, they are technocratic in nature. It's fine. But if we care about justice, about rights, we need to be able to organize and indeed advance this agenda. Like was said about the migrants in Singapore, already in the way the terms are used, there are certain values which are double standards for citizens and for migrants, and for refugees, and for ethnic group, all those groups that don't fit into this idea of nationality, of national agenda, of community in a very strict sense. Now we need to challenge this kind of construct. Now, of course, does this make us, at the least this kind of emancipatory social scientists, well seen by the government? Not necessarily. What we have seen actually is that the space, the civic space, has become narrower and narrower and narrower. If people have critics about, this is happening in Indonesia, right? Some people have criticized the environmental policy of the government. Now they are being brought to court. Now we have other cases in Thailand. We have also case in Singapore. So the space for a debate is becoming less and less so. And this is another crucial role of scientists like us, because we have the data to do an evidence-based alternative discourse to government discourse. So we have the data to build our argument in public. And this is extremely important at a time when civic space is becoming more restricted across the region, if not in the world. I want to answer one question about the young people, whether Junction and GDN is for young people. No, it's only for senior people. Yes, we are senior, the 1 year. I am quite old, I confess, but we are not only for senior people. Actually, we are very inclusive towards young people, and our activity, I am sure also GDN activities, are very open, because the change will come from the new generation of scholars and activists together. So it's extremely important to involve young generation from now and to learn from the young generation, because indeed they bring very different values, and they will have to again enlarge. They are fighting in many countries like Myanmar, etc., to create again a more open space. A last comment on health. If COVID would be seen as an health issue, would be fine, because health, according to the World Health Organization, is the complete status of well-being in a very broad sense, which includes social, psychological, mental, etc. The problem is being seen as a medical issue, is being seen as a narrow medical issue, which means health doesn't have any kind of social dimension, which is recognized in the World Health Organization. So the World Organization, the way the terminology of health is used is actually a comprehensive terminology. But the way we are seeing this epidemic is much more medical and much more medical technocratic, meaning also referring to technologies rather than a social behavioral change approach. So now, for instance, this is my last remark about the vaccine and the hope that are being put on the vaccine, which we all agree is extremely important, but we also know that it's not going to be enough. We still need behavioral change. And this is always the case. It's been the case for HIV/AIDS, it's been the case for other diseases. It's never sufficient to only have technological drugs or condoms, or in this case, vaccine. You will always need also to have behavioral change in the way we interact with each other, in the way we talk to each other, etc., in the way we use masks or not use masks. So social science is essential to control the pandemic and to plan for a better future. So if policymakers don't notice, well, it says something about policymakers, doesn't it?
Thank you, Leah. Thank you, Leah, for that. I won't try to obviously summarize any of what all of what has been said. This has been really a fascinating conversation. But I think as we talk, as we made many arguments for the value of social research and social scientists, I really think we're getting to a point that when we agree on the fact that the value is a function of like walking the line between an instrumental understanding of an instrumental use of knowledge, right? Social science is part of understanding why this is a pandemic, in fact, and how to resolve it. So an instrumental value of knowledge on use of knowledge on one side, and also a normative use of knowledge on the other, about the future and justice and how things should be. Right, how we want things to be rebuilt, and all of that. So walking this line between an instrumental and a normative value of knowledge really requires rethinking the public role of research and researchers in society, and calls for a discussion about how to organize, across borders as well, within countries, but also at the regional level, as Inaya was suggesting. And ultimately also just thinking of all of this as a system, where there are different players and there are different parts, society, governments, research, private sector, people, and all of this needs to come together, at least to understand where the social researchers actually sit and what they bring. And I like the final note on youth. I think obviously this is something that is absolutely important, to include youth in these discussions, irrespective of the level and irrespective of the format that we have. So thanks for all of you who have mentioned that. We have to close the webinar here, almost on time, just 2 minutes late. Thanks everyone. Thanks to the speakers, of course, Kian, Woon, Inaya, Rosalia, and of course Vedi for his comments. We will be posting an edited version, slightly edited version of this video online, so you'll be able to watch it again. And please check the social media channels of all the organizations that have been represented here to know more. A final reminder the compendium with the notes from the 11 countries will be published before the end of the year. So please check Julian's website and ARC website and say Junction's website to get the document and read also about the other countries that we worked on. Thanks again to everyone and have a great rest of your day.
Thank you.
Bye-bye.
Thank you, everybody. Thank you, Vedi.
See you in Singapore soon, eh?
Yes, yes. We'll meet
Okay.
up. Yeah.
Okay,
Bye
bye.
bye. Thanks, everybody. Francesco and all. Yeah. Inaya.
Thank you everyone.
Thanks, Rosalia, for
healthy and
hosting
well.
us. Yeah.
Yes, thanks to
Thank
Junction
you,
for hosting
Leah.
this.
Bye bye.
Bye.
Bye.